expected, weren't we? About 30?
Yeah, let's make a start. Some people might have arrived late.
Okay, Julia.
Thank you. I'm Julia O'Connell, and I'm currently the chair of the Regional Health and Safety Committee. And I'd just like to start by welcoming you all.
Hello,
to
this is Andy Trigger speaking. Can anyone hear me?
Hi, Andy.
Hi, Andy. We've just started. We're just doing the intro.
Can you turn your mic off, please, Andy?
Okay, so before we start the formal webinar, it's just to let you know that this webinar will be recorded and will be put on the website so that members can watch it again, and it can also be shared within your branches. As I'm sure you're aware, health and safety is high on the agenda at the moment, both nationally and regionally, and there's a big drive to recruit more reps. Last week, when the figures were shared with me within the region, approximately 80 members have come forward, and this number continues to grow. And that's obviously really pleasing to hear, particularly with the increase in safety issues as a result of the COVID-19 situation. And I know that the region has been they've been doing phenomenal work on creating capacity on health and safety rep training, and also providing this series of webinars to help new reps and existing reps along the way. It's my pleasure to introduce the lovely Liz Woodhouse, who will be presenting the rest of this webinar, and she will be supported by the equally lovely Rosie. But before I hand over to Liz, I'd just like to run through a little bit of housekeeping with you. So this webinar is subject to the Working Together guidelines. They were attached to the webinar invite, and so hopefully you've all had the opportunity to read them. To enable the webinar to run smoothly, please can you all mute your mics and turn your cameras off so that you can only see those that are presenting the webinar. There are two presentations within the webinar. They will take approximately 15 minutes each to go through, and they'll be followed by an opportunity for you to ask questions. If you've got any questions, please can you type them into the chat function, and then Rosie will be able to read them out at the relevant time. And the session will conclude with Liz providing a summing up and also information about your next steps. So without further ado, I'll hand over to Liz.
Thank you very much, Julia. So my name is Liz Woodhouse, and I'm the area organiser in the southeast, or an area organiser in the southeast, and I'm also health and safety rep for my office, and former secretary to Julia's regional health and safety committee. So we've worked together before on the health and safety committee. So I'm thinking about you. You're liable to be members, activists who work in and for our public services. So you could be working for the NHS as healthcare workers, you could be nurses, student nurses, support staff, social care workers, ambulance staff, social workers, administrators, school staff, working for the local authority or police and justice. You could be in the voluntary or community or private sector. You could be providing energy or water, or providing leisure facilities. And I apologise if I've missed your work area out, but what I'm trying to kind of show you is the breadth of services that our members provide to the public. So it's a big, UNISON is a big family. Okay, so today the aims are to encourage members to take up an interest in health and safety and well-being, show how UNISON organises, supports and trains health and safety reps for this role in the workplace. And we want you to be more confident and active in your workplace with UNISON. And hopefully for you to recognise health and safety issues in the workplace, to improve your knowledge of the training and support available for you to help your members with health and safety issues, and then to consider the next steps to take up training and become a UNISON health and safety rep. So if I start with the 1974 Health and Safety Act, this act was monumental in changing health and safety in the UK. Health and safety was now the responsibility of everyone in the workplace, rather than something that was done to you by your employer. Now employers must work with staff to improve health and safety, and this allowed workers also to appoint health and safety reps, and these reps have legal rights to be both informed and consulted about health and safety issues at work, so that they can then pass that on to their members. So staff have the right to set up a health and safety committee. If an employer receives 2 written requests from a union health and safety rep to form a committee, they are legally bound to do so. The committee should be equal, 50% managers and 50% safety reps. And this is part of the Safety Representatives and Safety Committees regulations of 1977. So lots of things went on in the 70s around this. A common issue with safety reps is that management tried to get them to write health and safety risk assessments. It's the employer's responsibility to ensure risk assessments are carried out, and safety reps should approve and be consulted regarding risk assessments, but not to be responsible for writing them. Also, risk assessments must be shared with workers who are at risk. And regarding the COVID-19 pandemic, there's an awful lot around risk assessments, so I kind of do refer to them. So the type of health and safety problems that you may have at work, there are many and varied. Currently, COVID-19 and how we ensure our members working in the front line have everything they need to minimise the risks to their health and safety. How those that have been furloughed or are working from home prepare to return safely to workplaces. And this is why we need members to become involved around health and safety to keep yourselves and your colleagues safe. Your workplace is 50% safer if you have active unions and health and safety reps. So that's an important statistic that we'll kind of refer to later. So with COVID-19, what we're seeing is at the beginning of the pandemic, inadequate PPE and shortages in some settings. And UNISON did a lot of work with members around reporting where those shortages were. And then we had that direct link in to the Department of Health so that we could report those shortages. Social distancing and gearing up to get workplaces ready to return. Difficulties with preparation for children returning to school, and you'll see, you'll remember just a few weeks ago, you know, every child under the age of 11 was hoping to come back to school for the last 4 weeks, but that has to be overturned because it is just not possible to take that volume of school children into a school and keep those safe distances. So workers are pressured to return to work when they should be shielding. We've seen refusal to allow home working and lack of furlough or full pay if you're not on NHS terms. Where I've had some doctor surgeries, they're private companies, they're not under NHS terms, and we've had to individually intervene for our members to get them that full pay to be working at home, because what they were offered by their employer was just, well, you go off sick then. So we've had some successes there, but that'll only be for our people that are in membership. So there's lack of adequate sanitising, cleaning and toilet facilities in workplaces. Access to meaningful current risk assessments, which is very important. And then the fear and anxiety about the safety of self and others and vulnerable people at home. So there are quite a number of issues around health and safety that come up with COVID. Also, the lack of test, track and trace to support return. And I think it's all gone very quiet around test, track and trace. I'm not sure that I've heard anything about the Isle of Wight testing and how that's going, but it's very difficult without these facilities. So there are many and varied issues pre-COVID around health and safety as well. And these are the more traditional things that you would have heard of: unsafe or damaged equipment, inadequate lighting, untidy and overcrowded or poorly maintained workplaces, obstructed fire exits, unsuitable facilities, toilets, rest or changing areas, and extremes of temperature. There are also hazards that are less obvious and affect health over time. So exposure to chemicals, fumes and dust. So for example, asbestos. Manual handling and computer keyboard strain and those repetitive injuries gained by doing things again and again. Now radiation, the beginning of my work as an activist came about because of the exposure of my aunt, she worked at the atomic weapons establishment at Aldermaston, and she worked in the laundry in the 1950s, and they had static monitors on the walls, and in 1971 they were all given film badges, so they could wore these film badges on the body, and in they walked to the laundry, and it was discovered that there was massive exposure in the laundry and lots of contamination from plutonium. So the laundry was shut. The 15 people that worked there were sent to Sellafield to have whole body monitoring, and my aunt was one of them, and she had 2 plutonium burns in her lungs. So they worked for the Ministry of Defence, and for years we were trying to get compensation for those workers. Unfortunately, they all died, and one of them was able to get on his death certificate that he died from an industrial injury, because when they did a post-mortem, he had sort of plutonium gravel in his liver. So that was all that exposure. And one person is able to get death through industrial injury. Anyway, sorry, digress. So again, shift work. If you work shifts at night, you are paid extra money, and that's kind of compensation is from the fact that working night shifts shortens your life expectancy. Heavy workloads, again, over time will have an effect on you and the body. So recently recognised as health and safety risks. So in more modern times, we have sexual harassment at work as an issue, violence at work and violence on staff, working alone, low morale. There may be bullying and intimidation by managers or colleagues that has an effect on your well-being, and also work-induced stress. So these new things around well-being and mental health issues also. So there are issues as well for women around health and safety and pregnancy. We recently saw a survey that the TUC did on pregnancy and COVID, and they quizzed 3,400 women, and a quarter of them reported problems, and they were things like being singled out for redundancy or furlough, required to take sick leave when they weren't sick, having to take up unpaid leave, or starting their maternity leave early, or actually leaving the workplace. So all of these things are illegal, and all are because the employer did not act to make the workplace safe for them. So the TUC are trying to encourage us to seek action. So also the menopause too, the age range of say 45 to 55, there are spikes in sickness for women, and there are also spikes in women leaving their employment because their employer isn't, that they don't feel that they're being supported with this temporary change for them of the menopause. And we're seeking more women into health and safety rep roles because 79% of our members are women, and it would be absolutely great if we could have 79% of our health and safety reps as women too. So those are some of those issues. Also, the dramatic rise in cases of domestic abuse since lockdown. It really has doubled. You know, there are really terrible circumstances for people. So this affects colleagues and members and their families. And we offer training and support in how to recognise and support families. And we can refer to There For You for welfare. Now, There For You is our charity, and each branch funds the There For You charity, and so we can offer support to members that are in difficulty. And also there's the National Domestic Abuse Helpline. Okay, so I've got some key statistics for you for Great Britain in 2018-19. In the main, some of the figures are slightly earlier than that. But there have been 147 workers died or killed at work in that period. 1.4 million working people suffered from a work-related illness. 2,526 mesothelioma deaths due to asbestos exposure. This is a 2017 figure, but again, my own father-in-law died 10 years ago of mesothelioma, and his exposure was in the 1950s, again, I would say, and he was exposed whilst working at the in Customs and Excise. And they knew about, we've known about asbestos exposure for a very long time, and they could have provided protective equipment for their workforce, but they decided not to. So this is why, whilst he was still alive, he was able to sue the Customs and Excise, or may even been the Ministry of Defence. But the judge said, you know, you have been robbed of 9 years of your life. And that was their kind of legal estimation. So 581,000 working people sustained an injury at work, according to the Labour Force survey. 69,208 injuries to employees reported under RIDDOR. Now, RIDDOR is the Health and Safety Executive requirement, reporting injuries, diseases and dangerous occurrences. So that's the regulation. So serious injuries. 28.2 million working days lost due to work-related illness and workplace injury. 15 billion estimated cost of injuries and ill health from current working conditions. That figure is actually from the year before, 2017-18. But you can see with the last two figures that the cost to the economy is huge. And just imagine what these figures are going to look like for 2020 when COVID is added in amongst the mix. It's going to kind of blow these figures out of the water. And so you can see if we can make workplaces 50% safer with unionisation and health and safety reps, you know, these figures can be affected. And each one of these figures is a personal tragedy for the person involved and their family. Okay, so are you good at talking to your colleagues about issues at work? So are you a good listener? Do you like helping and supporting people? Are you open to people coming to you for help and advice? And are you able to request improvements for yourself and your colleagues? So are you able to talk to managers about seeking improvements? These skills are helpful in the first steps for our health and safety rep opportunities. and we give you training and support to carry out this role, and mentoring beyond that. So the UNISON Health and Safety course, what we're offering is, before the course begins, 5 additional webinars on health and safety topics during June and July, and I'll give you the topics later. A UNISON national pilot online course that's already full up, so you won't be able to get on that, unfortunately. And then the Southeast Region Health and Safety online course will be in September, and that's where you'll be able to apply for that, and we'll continue to run those courses until our reps are trained. So that leads you then, once you've done that course, to become an accredited health and safety rep. Okay, now I just want to break for a little while for questions, and so if you're able to put some in the chat room. I don't know if, Rosie, there have been any questions?
Not yet, so if anyone has any, feel free to type away. I discussed a little bit about what has already been said in there. In regards to how COVID-19 and particularly health and safety is affecting our black members and disabled members and our different equality groups, there will be a webinar later on the 2nd of July that helps advise and talks about this. And just in regards to the domestic abuse that Liz briefly mentioned, Vicky Gibbs will actually be running a domestic abuse webinar for activists, and more information will be sent to branches shortly, so keep your eyes peeled for that. And so we've got a question, Liz.
Yeah.
What would be the difference between an accredited rep and one that hasn't done the course?
Okay, an accredited rep is then able to negotiate with the employer. So if you're not accredited, then you're not a health and safety rep. So it is really important for you to do that training. There are things that you can do in the meantime while you're waiting for the training, and I'll talk a little bit about those later, but you will not be able to get facility time if you're not accredited, and you will not be able to actually sort of attend meetings and, you know, I don't know if that makes sense. Does that cover the answer, do you think?
Yeah. So for existing health and safety reps, can they still sign on to the webinars in June and July?
Absolutely, absolutely, yeah. They're kind of little tasters to what we really want to do is keep people interested while we get the training underway, because what we've done is we've moved from face-to-face training, and that needs to be changed into web-based training while, you know, we have to do all this social distancing. It's very difficult to get back into the classroom. So absolutely, as this one today, you know, if you're interested in the subjects, please come along, whether you're already an accredited health and safety rep.
Brilliant.
Okay.
Do you have to do both the national and local courses to become accredited?
No, that national pilot that I spoke about is that's like we were able to get 6 places onto that course, and it is just that, it's the pilot, so it's the first one. Once that's done, the people that have attended that are accredited, and then the regional course that we talk about is just everybody on that course will be from our region, and then once you've completed that course, you will be accredited.
Brilliant.
Okay.
Is there any bar between being the, oh sorry, I've lost the question now. Between being the employer health and safety responsible person and being the UNISON accredited rep? Are they at the same time?
Okay, that one I might have to find out for you. if you are employed by if you're employed by your employer to be their health and safety representative, you know, when I talked about that 50-50 managers and union health and safety reps, union health and safety reps are actually members are the ones that nominate them. So if you are employed by the employer to be the health and safety rep, then that's kind of different. But I will take that question away, and then if you look, once you can see the recording on the website, we're going to put frequently asked questions. So I think I will just make sure and get a better answer for you to that question.
And do you have to be elected to be a health and safety?
Yes, you do. Sorry, you do have to be. You have to be nominated by 2 members, and then the branch kind of ratifies that, and then we put you forward for the training. That's the process.
Okay, brilliant. Has anyone got any other questions?
What I could do, Rosie, because there's also a section at the end, a little section for questions, so I could crack on, and people may find that some of the things are kind of being answered.
Okay, lovely.
All right. Thank you. So let me go into more detail about the health and safety webinars. You don't need to take notes because all of this stuff will be emailed to you around the subjects, that type of thing. So the first one is going to be hosted by Liam Kenny, and it's risk assessments and COVID-19, and that's going to be Thursday, the 25th of June at 11:30 a.m. So that'll probably be a similar thing, about an hour. And again, if you can't make it, it probably is going to be recorded and available later on the website. But it's a good opportunity. You know, you'll be able to ask questions, and it goes into a little bit more detail around risk assessments and COVID-19. Then we've got equalities and health and safety on Thursday, the 2nd of July at 2 p.m. Now that one is being hosted by Vicky Gibb, and again, that's going to be about an hour. Wellbeing and mental health on Thursday, the 9th of July at 2 p.m. That one has been hosted by Abby Dunn. Health and safety and the law on Wednesday, the 15th of July at 11:30. That one is going to be hosted by Louise Barter. And then an additional one, women and health and safety, on Tuesday, the 21st of July at 11 a.m. And I think that one's hosted by Vicky Gibb. And they will all be loaded onto the website afterwards. They'll be recorded so you can see them later. They'll all be approximately an hour as well. Okay, so the information will be sent to you so that you can sign up. So don't worry about making a note of anything. So the regional course, what you'll need there is a computer or tablet to access Microsoft Teams. You'll need permission from your employer if you're using your employer's IT equipment. You'll need agreed facility time, and to be able to commit to attending seminars of up to 3 hours, either once or twice a week, depending how the programme is laid out. On the pilot, I think they had Mondays and Fridays on that particular one, but it may well be once a week. And it's a total of 30 hours approximately of learning. So those, where you need permissions from your employer, we can help you with that. Okay, so the health and safety course, the learning, building local trade union organisation to help UNISON improve health and safety standards which protect members. So UNISON Health and Safety representatives' rights and your members' rights to a healthy and safe workplace with adequate welfare facilities. The skills you gain to enable you to carry out your job as a UNISON Health and Safety representative. So those are the main aims of the learning. And Health and Safety rep's job is a UNISON role. So recognised trade unions appoint their health and safety representatives. So they're not appointed by the employer, they are appointed by the members. The law supports union organisation, it doesn't replace it or give health and safety representatives any special privileges. Health and safety representatives' activity is trade union activity, and your responsibility is to members and the branch. So it's the kind of beginning of our democracy. Your members nominate you, you become the health and safety rep, and you are then part of the branch organisation. So it includes being involved in other UNISON issues, playing a part in developing and building the branch organisation in the workplace. So safety rep and safety committee regulations, it's known as the Brown Book or the regs. I don't have a copy with me because I'm at home, it's in the office. Representing members to the employer in consultation with health and safety inspectors. You carry out workplace inspections every 3 months. You investigate hazards, complaints and incidents. You receive information, facilities and support from the employer or health and safety inspector so that you can carry out your health and safety and other functions. So this health and safety role is something that you do as well as your job. So you need support to carry out that function. So attending joint health and safety committees, and you get paid time off to carry out your role and undergo TUC or union approved training. So that was the training I was talking about that makes you accredited. There's additional training that you can do to enhance your skills later, but that first step is that 30 hours of learning that gets you the accreditation. Okay, once you're trained, talk to your branch about your workplace and also branch priorities to see how your health and safety issues at your workplace fit in. Seek a mentor from the branch or region, and already you would have been contacted by your local organiser or your area organiser, so you've got somebody already that you're in contact with. Discuss your training with your members and their needs and issues around health and safety and well-being. Are there any quick fixes or quick wins? And I'll explain that in a moment. So if you survey your members, that will give you a firm base for seeking improvements around your workplace, giving you an action plan. And I'll give you an example of something that I do regularly in work with some of my branches. So in Oxford hospitals, say, I with the branch, with the stewards, we do a stall, and at Christmas time we put a little Christmas tree. It's about 1 foot high. It sits on the desk, and I have gift tags, and we ask people, fill in the gift tag and hang it on the tree. And what we want to know from you is what would make your work life better. So what Christmas wish do you have for improvement at work? So people come along and I sort of bribe them with a bit of chocolate, bit of Christmas chocolate or a satsuma or a little UNISON freebie, and they'll fill that in for me. We hang it on the tree, and then after the stall has happened, I collect everything, and I might have 30 gift tags. And looking at them, I can think that a couple of them are going to be about a pay rise. Well, that isn't something that we can get as a quick win. But one of the things might be, I wish people thanked me for my work. Now, that's something we can all do for each other. So we can all appreciate each other and say thank you when people do things for us at work, when things work well, saying thank you. But we can also take that to staff side or take that to managers and say, what do you do about reward and recognition? People are crying out for some idea that what they're doing is the right thing. How do you thank people? You know, so that's a quick win. Another quick win example is when, as a governor, I was a health and safety governor, and walking around my school, talking to the cleaners and just saying, you know, how are things going? And one of them was saying, it's a real pain that we have to lug these heavy hoovers up the stairs to clean upstairs. So in my view, that's a really quick gain. Buy another hoover, keep one upstairs, keep one downstairs, and then, you know, immediately somebody hasn't got to lug a hoover upstairs and perhaps get an injury. It makes their job a lot easier. So that's a kind of another example of a quick win. Okay, familiarise yourself with risk assessments, policies, procedures around health and safety, and any committees you should join or start up. So we were thinking about model employers re-COVID and what they should be doing. So current risk assessments, ensuring social distancing for all staff and relevant PPE if that's required, health and safety briefings for all staff, inspections with you around safe movement and social distancing and increasing effective sanitising, working from home for vulnerable and shielding and those whose children have not returned to school or who cannot avoid public transport, free counselling for those who want it, access to free wellbeing classes, team welfare meetings, welfare and financial assistance, free loans, signposting for those with in difficulty, improving training for first aiders to spot issues around potential COVID, and paid time off for testing. You may well have other ideas about how to improve the workplace. Your branch, think about a wish list for what is a good employer and how it looks regarding health and safety and well-being. And the world has changed. We're not the same now, 11, 12 weeks in, as we were in late March. Take this opportunity to ask for what you and your colleagues need to make your workplace a safer and healthier environment. So the benefits of being a health and safety rep. You'll be keeping yourself and your colleagues safer. And as we saw from that earlier statistic, you know, 50% safer if you've got a unionised workplace with health and safety reps. Your personal development and your journey beginning with UNISON. Once you have completed your training, you're on a pathway to continuously develop your skills. You're involved and empowered with your employer. The health and safety role is important to support a safe and healthy workforce, is going to reduce costs and increase productivity. Take your knowledge home to keep you and your family and friends safe. Build strong working relationships with your work and UNISON colleagues. It gives you a broader perspective. You'll be part of the biggest movement for social change, and we are determined to make our society fairer and equal so that we all prosper. Oh, I didn't know I was going to do that. So I don't know if there are any further questions at all. Rosie?
So I think I'll give people a chance to type up some more, but I'll just talk about one that we've had in the chat.
Yes.
So what health and safety role can we have within our workplace? And Vicky's already explained a little bit about how you could be a workplace contact. And Pat said, obviously, that you should have a responsibility if you notice something that's unsafe or that could be harming people's health and safety, then you should raise it.
Yes.
But is there anything else that you may want to add to that?
No. Say, what was the question again?
So what health and safety role can we have within our workplace until we get until the training happens.
Yes. Well, some of the things that I've mentioned that you can do, you can kind of familiarise yourself with those policies. You can talk to colleagues, because you will need to get 2 members to nominate you. So you can start those conversations around, you know, I'm thinking of becoming a health and safety rep. You know, would you nominate me for that role? If there is anybody who's currently doing health and safety in your work area, get them to mentor you as well. Get them to tell you about the types of stuff that they do for health and safety. The workplace contact is a good one. So that's somebody who isn't trained but is interested in the trade union and interested in communicating with members and us, and is kind of like our eyes and ears on the ground. You may come across issues, as Pat said, that you think are unsafe. Now, you know who your local organiser or your area organiser is, because we've been in discussions with you, we've sent you emails, we maybe have rung you. So if you are concerned about something, then give us a ring and talk to us about it, because it may be something that we can help with, you know, and we'll take that on board as you being a member, so we can help you in that vein and maybe support you. Okay?
Brilliant. And can you shadow a current health and safety rep?
Yes, in fact, that's a really, really good idea. Something I'd forgotten to mention was that's a great idea. And also you'll find people in the branch who have perhaps previously been health and safety reps. So there might be somebody there if you can't find somebody locally. But if you know somebody that's currently a health and safety rep, that's a great idea.
Brilliant. Has anyone got any other questions at all?
Okay, well, to quickly sum up, I just really want you to take advantage of the webinars and really think about that next step to signing up to our courses, because we really do need more health and safety reps. We really do want to keep everybody safer in their roles, and we want to look after our members, and that's how we're going to do it. So thank you very, very much indeed for your time, and I hope this has been of some use. Okay, thank you very much.